this video, we will demonstrate how to perform an arch scan with the 10x10 field of view. Launch the PreXion 3D Explorer console. Select New Registration and enter the patient's information, including an ID number. It is recommended to use the ID number or chart number that is provided in your practice management software. Once you have entered the information, click Register. The patient that was just added will be highlighted blue in the patient list. Click Select Scan Mode, select CT, then Arch, and then the patient size. We recommend that the image quality be in HD and the resolution in standard. Click Check Scan Area, and in the exam form, verify that the patient's information is correct, enter the operator initials, and then in the description, describe why we are taking the scan. For example, airway analysis. Click OK, and click OK again. Have the patient stand facing the unit. On the LCD screen, use the gantry arrows on the far right of the screen to raise or lower the machine to the height of the patient's chin. Ask the patient to rest their chin on the chin rest and guide their hands over to the handlebars. When taking a scan, we want the occlusal plane parallel to the floor. To achieve this, we will adjust the gantry height to bring the patient's ala and the tragus of the ear parallel to the floor. Turn the front knob into the vertical position and move the forehead rest to the patient's eyebrow level. Turn the knob in horizontal position to lock it into place. Turn the top knob to the left 2 to 3 times to loosen it and gently push it forward to meet the patient's forehead. Turn it to the right to tighten it up and lock it into place. Looking from behind the patient, use a mirror to make sure that the patient is straight and not tilted. Use the headband to help secure the patient's head into place. Looking at the highlighted field of view box on the LCD panel, use the arrows on the lower left to adjust the vertical dotted line so that it is at the corner of the eye. Press and hold the exposure button until the light on the unit flashes yellow and you hear a beep. Once satisfied with the sagittal scout, click the camera front icon to rotate the gantry to the patient's frontal position. Using the arrows on the right and left sides of the camera view, adjust the vertical line at patient's midline. Press and hold the exposure button to take a coronal scout. In your scout, verify that the image is centered, or readjust and press and hold the exposure button again to update the scout. Once properly aligned, click to scan.
The scan is starting. Please remain still until the scan is complete.
Turns green, press and hold the exposure button until the light turns blue.
The scan has finished.